Hi, my name is Brandy Miller. I'm the founder of Becoming Well Health and Hormones, and I'm also a certified family nurse practitioner. I started this series, it's called Something About You, where we talk about the science behind the symptoms and of common things that people are having. I see a lot of questions from people online and just questions that my patients ask me, so I've created this series so we can talk about it. Today, episode 1, we are talking all about hormones, specifically with women in perimenopause. I think it's good that we go all the way back to the basics and we just break it down from the first thing, which is the major factor of things that are affecting women when they're going into perimenopause and menopause, and that is the hormones, okay? I get a question a lot. Why do I feel this way? Okay, and it's a common question that a lot of women want to know once they start going into perimenopause, because they're like, I was feeling okay, and now I have all these weird symptoms and I don't know why I'm feeling this way. Well, the hormone is the main culprit, so let's talk about it. So what are exactly our hormones? Hormones are chemical messengers, okay? They're chemical messengers, and the way that they go out into the body is the brain releases the hormones, the chemical messengers, and I think about them as little text messages that go out. They go out into the bloodstream and they distribute throughout the body. A lot of times people think when we're talking about menopause and perimenopause that we are just talking about our reproductive organs, and that is not true. These hormones affect a lot of organs in our body, okay? They can affect, if you can see this list here, our mood, sleep, energy, our metabolism, muscle, bone, skin, and even sexual health, okay? So they are way beyond just reproduction. They affect so many things in our body. The 3 major reproductive hormones that are affecting women when they're going into perimenopause and transitioning into menopause is estrogen, progesterone, and testosterone. And a lot of people think when we're talking about testosterone, we are talking about men, and that is not true. Testosterone is the primary male reproductive hormone. However, for women, we also have testosterone at a lower level as men. However, it's there. So estrogen, when we're thinking about estrogen, it affects the bone, brain, skin, vaginal and urinary health, and temperature regulation. So ladies, when you are having those vasomotor symptoms like hot flashes, you can blame your estrogen, because that is what is happening. Now, I also wanted to let you guys know that a lot of times when we talk about perimenopause, women say that they're losing their hormones, which is true. The hormones will start to decline. However, at the beginning of perimenopause, the hormones are just fluctuating like this. And so it's not just a steady decline of the hormones being there and then being gone. They're starting to really fluctuate, and that's why the women will start to get these symptoms, okay? Now, progesterone has to do with the reproductive cycle, pregnancy, and it interacts with brain sleep pathways, okay? So a little tip, I guess, or this is one thing that we as healthcare providers, I always notice is, number 1, progesterone is the first hormone that will start to decline in perimenopause, and we can see it with women because that's normally the number 1 sign that women will start to feel like their hormones are off, because they'll come into their provider's office and they'll say, my menstrual cycle is irregular, and I've had a regular menstrual cycle and now I don't, it's either longer, it's shorter, I'm spotting between periods, and that has to do with the estrogen. Okay, and then when we're talking about testosterone, so this really has to do with a lot of our sexual function, muscle, bone, and androgenic effects. So when we're talking about androgen, we are talking about things like women could say, I'm starting to get a lot of mid-abdominal fat, I'm starting to lose hair, I'm starting to have more breakouts than I had before, I started having these hormonal symptoms, and that has to do with our testosterone, okay? So the main takeaway from this that I really wanted you guys to take away is if you are a woman and you are wanting to start going into supplementing, that symptoms plus history plus individual risk equals the treatment plan. Now I circled this individual here because hormone therapy isn't simply your hormones are low, so replace them. It really has to do with an individualized profile, okay? So I want you guys to know this. If you're having symptoms and you go into your healthcare provider's office, they're gonna look at a large picture of everything. They're just not gonna give you hormone therapy because your hormones are starting to fluctuate or you're going into menopause. And so I really wanted you guys to take away that it really has to do with an individualized treatment plan when we start talking about hormone replacement therapy, which we will talk about at a later episode. Okay, well, I hope you've enjoyed this episode, and there are a lot more to come. So if you have enjoyed it and you want to follow along with this series, then like, follow, subscribe, and I will talk to you later. Bye.